Howdy friends, it's Thursday, April 23rd, 2020, and I'm Seth Sumner, your city manager with your daily COVID-19 update. Our Tennessee Department of Health data today shows that McMinn County is still at 6 COVID positive persons total since the beginning of this pandemic. We're now showing, I want to look here, this is very important, I want to get to in a second, but a total number of cases, 8,266 across the state of Tennessee, with now 170 deaths. And we don't want to see any deaths, we don't want to see any more cases, but what we know is a blessing from the earlier projections of how bad this would be hurting our state and our people right now is that this is not a double digit, it's not a big increase over yesterday, and you can see right here the important thing we want to look at is that line is no longer climbing, but this line right here is now straight. It's flat. We are flattening that curve, which means we are getting close to seeing the other side of this pandemic's widespread in this first round of it. And so you can see that flattening of the curve that we've talked about since day one, and there it is. We're actually seeing that occur right now in Tennessee. We have a total of about 10% of cases that have been hospitalized, 793 hospitalizations, utilizing those 7,812 available beds, but not stressing that resource. That's been incredible that this has been so low. We are showing the good number that we like to talk about, still at about 51% of COVID positive persons. 4,193 have fully recovered from COVID-19. We are showing 170 deceased, which leaves us still at only 2% of our infected population being deceased from the virus, and over 8,096 people not, which is a good thing for us. We are now we continue to see this number increase drastically with our laboratory testing, and we did see from our Sunday event that tests were back within 2 days. So that's good. The speed of these laboratories to be able to test the samples and get those results back to those persons has been a wonderful and welcome increase in how rapid they're able to do that. Now testing over 123,000 Tennesseans. Tennessee is actually the 12th as far as all states in the United States, all 50 states looking at us. We're ranked 12th for the total number of tests. So we have really been aggressive with our testing over especially the last 2 weeks. And even where the Tennessee Department of Health has opened that testing up to everybody that wants to be tested to help with showing our data and making sure that we are able to discover those COVID positive persons, especially those who may not be showing any symptoms. So if they are asymptomatic, they don't have the cough, the sore throat, the fever, and they are still a carrier, we're able to catch that and make sure that person's quarantined so that we can protect our vulnerable population, our seniors, our elderly, our young mothers and children. We want to make sure that we continue to protect all of those people and people with weakened immune systems, because this does wreak havoc on those people. So we have to keep COVID away from those folks. So over 123,000 Tennesseans being tested now. And we see McMinn County has not changed again. We have 6 total positive persons through today, and 4 of those fully recovered, and that's out of 695 tests. So this still doesn't have the 334 tests that were conducted Sunday included in that. We're going to continue to see that number grow as those test results are filtered in through the Tennessee Department of Health and reflected in their data. So we know that over 1,000 McMinn Countyans have been tested so far, and we still remain at 6. I know that there has been in a long-term care facility, there's been some news discussing some people being infected and whether they're in our numbers or not. That depends on where they live, because remember, if we go back and look at how these numbers are tallied, it depends where that person's home is. So it could be that they work in a facility in McMinn County, but they live in a neighboring county. If they have tested positive, then their number will be reflected in that neighboring county and not in McMinn County. And that's how the Department of Health is classifying these cases by county, is by residents. So keep that in mind. So those numbers may not be reflected. It depends on where those people live. And of course, we can't, I don't know where they live if they've tested positive, and we can't share that if we were to gain that information due to law. So you may not see that number reflected here. But I know that's been a concern, and I will talk, I'll talk with you after the interview today a little bit more about Unified Command's approach to that. We've looked at this yesterday and today. No big changes here. We're now 9 days over peak for our daily deaths. We are down to projected 15. Well, we had a 15 deaths, which was a 14%. The only double-digit increase that we had during the entire pandemic was on April 14th. We're now 9 days past that, and that was our peak. And you can see these numbers are looking better and better each day as they are declining, and that's what we need to see so that we can get America, we can get McMinn County, we can get Athens open again. And that's what our goal is in the near future, is to have that plan that we can roll out and keep these good practices in place. But remember, COVID-19 is still a threat. The threat does not go away. Its infection rate does not change. It's we don't have drugs to help COVID-19. We don't have a vaccine, and we're not going to for at least several months that we know of. So keep that in mind, because we'll still have to use good hygiene. We'll still have to keep the good practices of staying apart, of social distancing. We'll still have to be very careful and cautious about that, and our contact with vulnerable populations. We'll have to keep all of that in mind, even as we're able to start reopening some of our businesses. So we are 19 days now past peak resource use, talking about those 7,812 hospital beds. We never got close to peaking out and needing more beds than we have. We didn't even get close to that, and that is a blessing. We're very thankful for that. You can see, you remember what this looked like previously, way up here, and now we're down here at the bottom on the need and availability versus the availability of hospital beds and ICU and ventilators, and we never stress those resources. So that's good. We are now continuing to trend down on COVID-19 deaths. You can see this increasing, and it likely will continue to increase. This number will go up. There will be more deaths, unfortunately. And we do want to share our heartfelt we want to lift up those families who've been affected by this virus. We've lost loved ones, we've lost friends and neighbors. We haven't been affected here in Athens or McMinn County near to the extent as the rest of Tennessee and a lot of our friends across the United States and around the world. We need to count our blessings on that. I'm thankful for everyone out there, everyone doing their part by staying apart and making sure that we're able to keep our infection rate as low as possible here in McMinn County. You've done a tremendous job, Athens. Thank you. With that, I like looking at those data sets and sharing that with you every day. But I do have a guest that we talked about over the last few days. who's boots on the ground, who is actively taking care of vulnerable populations in our own community. And so I'd like to welcome Mr. Kevin Lane, the Executive Director of Coordinated Charities, here onto the Daily Update with us. Thank you for being able to be with us right now. I know there's a lot of folks out there looking forward to your message. So I like to not assume that everybody knows everything, but I know Coordinated Charities is talked about a lot. You've got a lot of folks that come by daily that want to be helpful. Just in case there's somebody out there that's not familiar, tell us about Coordinated Charities.
Okay. Well, Seth, thanks for having me on. And to talk about our organization, Coordinated Charities is one of the best ideas I feel like ever came out of Athens and McMinn County. We were started as a local nonprofit organization as early as 1959 by an effort of local churches really right down the hill from us in downtown Athens to take care of people in our city and county. Ever since 1959, a lot of churches led that effort, and so they would all combine a lot of their resources together to make a strong and a solid resource for the people of this area and this county. And so we continue that work. In 1976, we became a 501c3 with the federal government, and we've been in our present. Coordinated Charities has been a lot of different places in Athens. We've been at our present location near the Athens Recycle Center since 2008. And who we are, led by the churches, we're an organization that expresses the love of Christ by providing for people's physical needs here in our city and county. The way that we do that these days, up until recently, has been that each week I have staff in our offices that receive people who have emergency needs. They can express those and provide necessary documentation and stuff for us to do things with accountability. And we take resources that have been donated by churches or our local United Way, or we generate through our own thrift store, or just individuals who are generous in our community. And we redistribute those resources out to people in need. We try to make sure that small problems don't become big ones, such as a flat tire that had to get fixed to be able to get to work. Doesn't cause you to have to face something going on because you fixed your car, you can't pay your rent all of a sudden. So for things like that, we act as a safety net for people in our community and a place that they can go and seek help, either with that, and we have an emergency food bank there as well. That's our normal operations. People support that through our store. The store provides all of our operational expenses, and more so that anytime that we receive a donation from the community or an organization like a Church of the United Way, 100% of that goes straight back to people in Athens and McMinn County. Nothing that we receive as a donation is taken for administrative cost or our operational expenses at all. We're very proud of that. But Coordinated Charities, and it is one way that we're able to operate at such a high level to help people here in our city and county that run into situations from time to time.
Well, you mentioned under normal circumstances, and we know that right now is not normal circumstances. So tell me a little bit about how COVID-19 has affected your service model, and what are the changes that you've had to put in place to still do what you need to do to help our neighbors in need during this pandemic.
You and I were talking briefly before we got started about all the different things associated with COVID-19. It's been a frantically evolving situation some days. And so starting even back in February and March, We were considering things to keep our employees and our people safe, having people lock down door handles, and that evolved into taking chairs out of our waiting room to, since I'm also the chief procurement officer for Coordinated Charities, going around just to find cleaning supplies. And so, we've all lived through that collectively about making sure we had appropriate stuff to do what we needed to do as that evolved. And then, I think it was late March, the 20th or 21st or 22nd, we received the order from the governor about safer at home. And so at that point, whereas the food bank is an essential service designated by the Department of Homeland Security, I did not feel like our thrift store or clothing store was, even though that's one of our primary funding sources. And so to protect the health of my staff that usually interact with up to 100 people, among other things, Coordinated Charities is a local nonprofit, but we're also a local small business. And so to protect my staff from exposure, we decided to augment or change our daily operations. So starting March 23rd, we closed our store to the public, but we made sure and certain that we would still be able to offer help and assistance to those in need. And following recommendations from the food bank in Chattanooga, who's one of our partners that we do business with, we decided to make a drive-through food bank available for people to at least come in, and if they had emergency food needs, we were still going to be able to serve them. We changed that, and we also changed where we're taking care of all financial requests by phone. And we've been doing that since March 23rd. This is the 5th week. Isn't that crazy?
It is.
It's the 5th week since we've been doing that. And so that's how Coordinated Charities has still been able, and a lot of days, there's, as a way to make sure the public is safe or those that we serve are safe, there have been very, very few people in my building, just a handful of volunteers, board members, and employees, for the most part, since this started 5 weeks ago. And so we can make sure that we do things in a safe and effective manner as far as that goes. So we are still, even in the midst of this turbulent time, we're still accomplishing our mission. We've still got help for people, and for those interested, we have plenty of food to help people. If people are struggling with food or means, we're here for you.
Kevin, let's talk a little bit more about your feeding program.
Okay.
Who are you feeding? When? How does all that work? If there's anybody watching that is in need, what does that look like for us?
Okay, so we are specific to McMinn County, and so we are serving McMinn County. That's our service area. There are resources in neighboring counties for those people, and just to make sure we're not diluting ourselves too much, that's always been our service area since I've been there, starting about 6 years ago. And so we serve people in McMinn County. It's really simple. If you need food or you need some additional canned goods to stretch what you're able to get, and which is a great way to think about it, all you've got to do, Monday through Friday, from 9:30 to 1:30, pull up into our parking lot. I'll be watching for you out the window, and when I see a car pull into our parking lot, I've got signs up instructing people to stay put in their cars, and I come out with a clipboard or a notebook out to vehicles, and all you got to do is roll down your window a little bit, and I gather whatever information I need. And if someone has not received services from us before, I will have an emergency food release on a clipboard to sign. Each one of those clipboards is sanitized with Clorox wipes after each use, and the pens. And then you need to have an ID. And so if you've got an ID, I snap a picture of that with a digital device, and that's all the records I have to keep right now, just to say it's a food release and an ID matching that release. It's real simple. And so and then we've got pre-packaged things of groceries. Most of the time, what we're doing right now, I've got a package of dry goods and a package of canned goods. And I'm taking those and I'm passing it to people through the car window. I've also have packages of things for people who may be homeless or people who are living in temporary living situations like motels. And so in those packages are different. It's food ready to eat or things that you can cook in a microwave instead of, just a regular canned good. And so that's the process right now. If you have a financial need, all you need to do is call. And if I don't speak to you directly, you can leave a message, and my administrative assistant is working from home, and she checks the voicemail each day and gets those back.
What is that phone number?
That phone number is 423-745-9625. I'll say it again. That is 745-9625. If you call and I'm talking to you, all I may do at that moment is take a name and a phone number, because I could be serving somebody else that's pulled up in our parking lot. And I do what I can in the afternoons to start working through that callback list. Some days it's been a little bit crazy, but I do my best to work back through that callback list in the afternoons each day.
So what are the sources that you have for food? You mentioned the food bank from Chattanooga.
Mm-hmm.
How are you able to get those resources right now for that distribution?
Well, the food bank in Chattanooga is our primary place where I go and I spend money that's been donated. Seth, I want to say one thing. Our community is phenomenal. And I'm sure you've seen that a lot of different ways lately.
Yeah.
I've had people walk up with $1,000 checks.
That's beautiful.
It is fantastic. And some of those have been designated for food purchase only. We've been receiving a lot of support from the community, and we are helping the community. Every day, people call in, people come by. Every day I'm calling back. I'm calling power boards. I'm calling landlords. I'm calling lodging places to try and help people who are in a fix right now. Some people are in a fix right now not due to virus-related things. Some people have just regular order-of-life things that go wrong, and we're still doing what we can with that.
Life is still happening.
Life happens, right?
Yeah.
And so we've still got that going on. I have seen an incredible amount of people that have had virus-specific things, loss of hours, loss of work.
Yes.
We've been working a lot with those folks. But back to the food, yes, that's our primary source of stuff. I'm not asking for a huge food drive at the moment, because that's an exposure risk. If I've got lots of people who have touched things, bringing those into my place as a distribution point. Some people have called to inquire about our specific needs, and I do appreciate that. There have been some very generous individuals who have gone and filled in gaps that I've had between trips to the food bank. Specifically, I probably do not want donations right now of like bags of chips or food ready to eat, because somebody would take that, open it, and eat it, touching everything. So like donations of non-perishables that people have to cook first, that would be better, if anything. Right now, nor do we want to encourage you to leave your home or your place of safety to go to a store to buy something to expose yourself to bring it to us. And so we'll take care of that as much as we're able to, or if you're just, or you can contact me over the phone to talk about that in further detail. What we have been able to do since this started on March the 23rd, we have used funds that have been donated, and I've been able to get 2 truckloads of food and other non-perishables from the food bank in Chattanooga.
Wonderful.
And so the first one that we got a hold of, we brought back. I was very thankful to get an order in down there because all the food banks are under stress right now.
Of course.
And so the first order, we brought back 2,281 pounds of food. And then the second order, we brought back, I think it was 2,317 pounds of food. And that has allowed us to keep up with demand.
Tons.
Yeah, literally. We've brought back over 2 tons of food to keep our shelves stocked lately. And so that is, that's allowed us to stretch what's been donated before. Typically, when you do a food drive, you receive a lot of beans, green beans, and corn. And those are very important because then I take funds that have been donated and I buy things like peanut butter, rice and beans, and canned tuna or canned meat, and I fill in those, or canned fruit.
Yep. And
I fill in those gaps. And so when I give somebody a package of food, it's a good collection of several different types of vegetables or meat or protein items or various dry goods. Right now in dry good bags, I've got macaroni, rice and beans, skillet dinner mixes, chips, different stuff like that. And so you can take those items, instant mashed potatoes, and either add to what you have or be able to create a meal out of it. So we've been able to, like I said, we've been able to get food. We've used funds to be able to purchase that. Later, when this is all over, we could probably use a food drive or 2 because essentially right now we're liquidating our food bank.
Yes. So we need to replenish those resources.
And I completely trust that this community is going to support their neighbors that way. After seeing what we've had go on, I have no doubt that we will carry on and we're going to be good.
That's what the friendly city does.
That's right.
When our neighbors
That's
are
right.
in need, we step up and we do whatever we can. Give the shirt off our back to take care of our friends. I love it. Wonderful keeping the food program going. What about other donations, other items right now? Are you still accepting donations of different types of products, of clothing, furniture?
Thanks for asking about that, Seth. I am asking anybody who will listen to hold off on donations right now. There again, we're talking about limiting exposure.
Yes.
And so when you bring something to Coordinated Charities, even if it's only just a bag, that's an exposure risk. If I have to go outside and pick it up and then take it in, I have to wash my hands or use a set of gloves right now because I'm trying to prevent exposure of something that could be contaminated, like that from the general public to everybody that we're serving. We've been serving a lot of people. And so we're asking people to hold off on donations right now. If I had a huge warehouse to store everything, I would be bringing it on, but we don't. And so all 4 of the bins on our front porch are full. Some people have left stuff anyway, and all I'm doing is at the end of each day, I'm just pitching it on a pile because without our store open, without my staff there, and without customers, there is nowhere for donations to go. Unfortunately.
So hold off on the donations of goods, but how else could people help you right now? Certainly financial donations are always accepted.
Financial donations are very welcome. Anybody who's interested could mail those directly to us at 109 Rocky Mount Road, Athens, Tennessee 37303, or you could direct that to help neighbors through the local United Way. They've been a very strong friend of ours lately in helping support our efforts. And I talk to their executive director, Paige Zabo, on a daily or weekly basis about those efforts. And so they are helping allocate aid to people here in McMinn and Meigs counties. Like I said, we focus on McMinn because that's just what we do. And but either one of those options would be a great way to support Coordinated Charities or other places that help people in our community. So either the United Way or Coordinated Charities at 109 Rocky Mount Road, Athens, Tennessee. If somebody had a donation, they could also roll through from 9:30 to 1:30 each day, and I'll take it in a gloved hand, and then process that later, as far as that goes as well.
Very good. Earlier, before we went live, we were also talking about some of the personal stories that you hear, and without sharing too much details, are there anything that just to let folks know how your donations, your monetary donations, what our churches working together are doing, and how they're helping our people, and how our people are actually hurting right now in detail?
So first of all, I want to encourage anyone that hears this or anyone that gets this message that it is okay to seek help. I cannot tell you how many people over the last 5 weeks now I've met who have told me through the car window, I've never had to ask for help before. And that is A-okay. That is perfectly fine. Seth, I'm meeting a lot of people that work in our factories right now. I'm meeting a lot of people who are servers in our restaurants right now. I'm meeting a lot of people who work in food establishments that just aren't open. I'm meeting a lot of people in other service fields, not caregiving, other things like that. I'm meeting a lot of people who usually work odd jobs, that just because all of this distancing is happening, there's no work at the moment. Dishwashers, cooks, all sectors of society have come through Coordinated Charities over the last couple of weeks. And I know a lot of people struggle with that. I've talked with some directly that say, hey, we're doing the best we can to take care of ourselves. We've never had to ask for help before. And so, by all means, the message I have is before you go hungry, or before you get in, before a small problem becomes a big one, reach out. That is our mandate, is to love and care for our neighbors the same way that we care for ourselves. That's our scriptural mandate at Coordinated Charities. And so when you speak to me through that car window or over the phone, I may just be taking your name and number, but I'm going to call you back and I'm going to look into your situation. And so, if what do you do if the supply chain, that for the car parts that get manufactured in our city, gets interrupted and they lay your line off, and, you have to still, your landlord's working with you, but they may be paying a mortgage right now, and so everybody is in a fix. Not everybody, but we're going through a difficult time right now. Together, we're going through a difficult time, and it is okay to reach out for help. I'll give you a couple things to back that up. Since over the past 4 weeks, starting from March the 23rd through the end of April the 17th, we've had 474 individuals or families reach out for help some way or another. That's phone calls, that's cars, that's and to be honest with you, since I've been working by myself there a lot lately, I'm still tabulating our records. I do know that we've packed up to distribute 7,631 pounds of these groceries. And so I wouldn't have been able to do that without the support we've already received from the community. And there again, you're talking about nearly 500 people over 4 weeks have reached out for help. If you're in need, it is okay to reach out for help right now. It is okay to seek resources. We're working with people. And so, you know, a typical question I might have for somebody that comes and says, hey, we're struggling with our rent this week, I'm going to ask, hey, have you reached out to your landlord? What did they say? How much are you short? You know, and that varies based on people's situations or how long they've been laid off. Everybody's waiting on unemployment right now. Everybody's waiting on that stimulus check right now. And I expect things to get better as that goes. It'll be really interesting here in May or when local power boards stop pushing back the deadline date on paying utility bills. And if you have trouble getting through to us, leave a message. Like I said, we're checking that voicemail at 745-9625. We're going to call back. Right now, I may ask you to email me a copy of your ID or a copy of your bill, or I may request your landlord's phone number. So just not that I can pry into your business, so that I can verify how much your rent is or verify certain things like that. It's not that we're trying to be invasive, but we're trying to be good stewards of what we've been given. And so we're getting it done. But you asked me to recount some of the cases that we've gone through and stuff like that. You know, so here's the local delivery service. That person lost work due to interrupted supply chains. There's cut hours at a local convenience store. There's a local factory that their line got laid off for several weeks. There's another local convenience store. Single mom got laid off. Or she had kids, and so when the kids aren't at school, she had to go off on FMLA to be able to take care of kids. I've talked to a lot of grandparents or people who normally keep kids or watch kids, and there's been a big ripple effect because the parents aren't working, they're keeping kids, and then the grandparents have lost a source of small income, which has made an impact on their ability to pay their rent or their power bill. It just goes on. We've seen a lot of different people who are all struggling during this time, and there's another factory worker. There's and I could name names of our factories, and even the factories may not have laid you off, but the temp service that you work for that's at the factory may have cut your hours to 21 hours every 2 weeks. Or your line gets called up this week but not the next week. And so there's a lot of struggle going on with people financially right now.
There is.
And so we're working through that. Like you said, we're doing it together. Yes. And we're doing it as the best of our capability as we can. Currently, we've seen our numbers taper off a little bit. The craziest day we had was a Tuesday about 3 or 4 weeks ago. We had 42 people call or come by that day in one day. Wow. Today I had about 11 or 12 so far, and so some of those range from crisis of I don't have anywhere to work, and I was living in a motel, and I don't have anywhere to go. Can you help me? To anywhere of hey, I'm just a little bit short on my rent because my line's not going back to work until next week. One person, and I applaud her honesty, had asked us for help, and so then I put her on my callback list. A day or two later, I called her back, said, hey, I'm getting back to you. We want to discuss this rent situation. She said, hey, I got my stimulus check, I'm good, but thank you. And so we've seen a lot of good stuff happen like that so far.
Good. Thank you, Kevin. Is there any other message that that's heavy on your heart right now that you'd like to share with folks watching?
Just the biggest message is, reach out for help if you need it. If you need it, call us up, shoot us an email. And be patient with us as our services have changed in our ability to respond to your need. Be patient with us. This is the worst time for a thrift store not to be in operation because everybody's off and cleaning out stuff. So, I'm getting a lot of questions about when we're going to open back up. And I know we're all working through that together. I know I've got a staff of about 10. So even after next Thursday, if we're not staying at home anymore, but we're still trying to keep a group of less than 10 people together, we're still working together with my board of directors. What does that look like as a store right now? What does that look like about, should I expose my staff to receiving donations from potentially hundreds of people in our community? And so if they're accepting that even with a gloved hand, that's encouraging people to get out, stir around, and potentially perpetuate that exposure. And so we're all trying to figure it out ourselves. And so patience is a virtue, and I will consider, I'm going to love my neighbor as myself, whether you need food or whether I'm trying to protect your health and security as that goes. And so we're here. We are very blessed, Seth. You asked what's on my heart. I was reading scripture this morning, Psalms 23, the Lord is my shepherd, there is nothing I lack. And I can certainly attest to that we have been well provided for over the past 5 weeks now. We've still got plenty of food. We've still got plenty of means to be able to help people and get through this together. Very blessed. Thank you for having me on. Any questions for Coordinated Charities? Again, 745-9625.
Thank you very much, Kevin. What a wonderful message, and to know that you are taking care of those folks that are in great need right now. And there are many of our friends and neighbors in that position, and there will be on into the future. A lot of folks are anxious right now. We don't know what May 1st, next Friday, is going to look like yet. We don't know what the governor and the president, we don't know exactly what will be rolled out, how we will be reopening some businesses, maybe not all. And folks are ready to go back to work, especially our small businesses, our business owners. They're ready to get back to cutting hair and doing nails and taking care of their clients. And we don't know what that is going to look like yet. We're waiting on word from our governor and our president to lead us as to what they expect and what those guidelines, recommendations, and maybe even further executive orders that say some businesses are open and some businesses have to stay closed. This is all a guess right now. There is a team in place in our state government, in our federal government, and right here in Athens that's working on a economic recovery plan. And the biggest part of this, it would be one thing if we could say, yay, we made it, there's no more COVID. Unfortunately, that's not the truth. COVID-19 will still be just as big of a threat to our health, to our public health, and especially to our vulnerable populations next month as it is today, as it was last month. We will still be at risk, and so we're going to have to adopt and keep good hygiene practices in place. We're going to have to still do some level of social distancing. We're going to still have to be responsible and look out for our neighbors in need. We may still have our elderly sheltering in place, and we're running to the grocery store or getting their medicine to take care of them.
Absolutely.
We're still going to have to be doing those things even after May 1st as we see a rollout, a reopening. And so it's called Opening Up America Again, is what our president has termed it. And I did want to highlight a few things that affect us as Tennesseans in the data sets that we're seeing now. And we are showing now 19 days of declining growth rate. 19 solid days of declining growth rate in COVID-19. That is incredible. That means hopefully we're on the back end of this pandemic. We're on the back end of this surge that we talked about last week, and we're really getting a hold on it. But we can't relax our hygiene practices. We can't relax our social distancing practices and have persons that may be infected, may even be asymptomatic, then starting to spread this disease at a higher, this virus at a higher rate once again. We do have to be very cautious about that for the next several months until we can get treatment, until we can get vaccines in place, until there's a plan to inoculate if that's a possibility. So I love that message of patience. We are all in this together. We're learning and growing and experiencing and witnessing this together. And we're listening to our professionals, the epidemiologists, the folks that are concentrated on our economy. We're listening to the smartest and brightest folks that we have on how we can get through this together. And we're going to do that because we're being responsible as Athenians. And that's proven in our data sets, that we have a lower infection rate than many of our neighbors, that we're testing at a higher rate than many of our neighbors. Athenians are being responsible. Thank you. We have got aggressive, I mentioned earlier, with our testing, not only in McMinn County, but throughout the Southeast Tennessee region and the whole state. And we are ranked now 12th in the nation for total COVID-19 tests. So you can think of all the other states and how much they've been affected, and we're 12th in the nation for testing.
Can I say a word about that?
Please, go ahead.
I want to say a shout out to the McMinn County Health Department. I was interested in that. I'm not symptomatic or anything, but I serve a lot of people, so I went out and got tested today.
Good.
And you can look up the McMinn County Health Department online, and they've got some parameters there about guidelines for testing, but you can also find the phone number for the McMinn County Health Department. I called them up, inquired about it, and they did a great job. So I went out there this morning, and I was in and out of there in about 10 minutes. And we're talking about protecting the safety of those that we serve or those that we're around or different things like that. And so they're doing a great job.
Yes, thank you. Good plug to our health department. And Jeannie Bentley leading that group. Really appreciate everything you're doing. And folks, if you have not been tested yet and you want to be tested, tomorrow is Friday. It's going to be 9 a.m. until noon. Go to the McMinn County Health Department. There will not be a local, there won't be a local assessment center like we had last weekend. We're not doing that in McMinn County this weekend. You can go to Bledsoe County. I think they're doing 9 a.m. until noon or 1 p.m. Check those hours on the Tennessee Department of Health website. It's also available in the media, but Bledsoe and I believe Franklin counties are having those assessment centers. If you work, if you're still blessed to be at work during the week and you've got Saturday or Sunday, look up those hours, go get that test. And so that is available for free for all people, anybody. I want to update you again on the Unified Command that includes, is led by Governor Bill Lee. Unified Command is now focused on mitigating existing clusters within long-term care facilities. So something I know that's been in the news and has been much talked about here in McMinn County just in the last couple of days are those long-term care facilities. There's a vulnerable population sheltering there, and they have largely been protected by not allowing visitors and things of that nature. So they've had good protocols in place. But we do have to be very cautious when we do have a positive test in those facilities because of how vulnerable the elderly are with COVID-19 and other underlying health conditions. And so the Unified Command is now focusing on mitigating those clusters where we do have several positive tests. They are mitigating that right now, and they are actually going to begin reporting those confirmed cases and those deaths as part of the Department of Health numbers. So in the day or two ahead, I think we'll see them report those care facility numbers back to us. And I know a lot of folks have had those questions for us as well. So that will be a separate set of data that will be showed to you by our Department of Health through Unified Command's focus on those long-term care facilities. So that will be data that we will deliver to you when it is available. Our economic recovery team locally is working. They're hard at work. That is through the Council Advisory Committee. We did update the City Council on that as well, and we appreciate their help and their blessing during this time of letting us run out there and take care of business and protect the public health, to protect your safety and the safety of our frontline folks, our firefighters, our police officers, patrol detectives, and even the folks right here in City Hall and out at Public Works, our recycling center, sanitation. The friendly city, Team Athens, is still right here at work for you, picking up. It's cleanup week. We're during a pandemic, and it's cleanup week. We are out there. I saw the knuckle boom going through my neighborhood today, going around and picking up folks' stuff that you've set out on the curb that you want to get rid of. It's cleanup week, and they're out there picking it up, not using their hands, but using that knuckle boom.
I had no idea that's what it's called, the knuckle boom.
Knuckle boom, that's what it is. That's that big trailer and
That'd
the
be a
guy
great,
seat.
be a great job or something to put on your resume. I'm a knuckle boom operator. You know that it's got a good ring to it.
It is. It's pretty cool. It takes a while to get a hang of it. I mean, you really have to appreciate what they're doing and how accurate they are to grab those items and put them into the truck without tearing up the yard, going too deep. So,
oh man, that's right.
So just saying a big thank you to Team Athens, to all of our Sheriff's Department, all of our volunteer firefighters that are risking life and health to protect public safety right now. Our healthcare workers, the hospital, our clinics, you guys, everybody is doing such a tremendous job. We cannot say thank you or praise you enough during this time. Keep up the good work. We're taking care of our neighbors in need, and we're carrying on our business even during this pandemic. Great job, everybody. Tomorrow I will have the president of TCAT Athens, Stuart Smith, on to talk about higher education and how that's been affected during this pandemic. So please tune in tomorrow for that. Just to reiterate, we still are under a stay-at-home order until April 30th, next Thursday, and it may be Thursday, maybe Thursday night, that we hear from the governor about what Friday morning is to look like. So please stay tuned. I know we're all anxious about that. We want to get back to a little bit more open. We want to see our friends. We want to get our hair cut. I know I'm starting to really get shaggy here. And it may be longer than May 1st. Let's just be aware and be okay with that, because we're protecting each other. We're protecting Grandma and Grandpa. We're protecting that newborn baby, because we're not getting out and being restarting the share of this virus and restarting that infection rate. We have to be very cautious of that going forward. All of those kind of just a cautionary tale.
I asked my hairdresser the other day, she was canceling appointments and stuff, and I said, now if I had a pair of clippers and I had you on FaceTime, how do you think that would go down? And she turned me down on it. But anyways, I found some other means to get that done. So. Good.
And
anyways,
I have scars on my skull, or I'd be happy to go short.
I mean, I can fix you up. I don't know. I'm not doing that.
When the governor says it's okay, well, I might. All right, folks. Thank you for being with us today. Certainly appreciate Kevin. We want to lift him up in prayers to make sure that he's able to keep doing what he's doing to help our neighbors in need. Send your donations. If I know some folks out there are not in need and they got the stimulus check too. I hope that's going to good places, doing good things for the people that are in need right now. So please consider that if you're able to. May God bless you. May God bless Athens.